More than 6,000 doctors recently met in Washington, D.C. for Internal Medicine 2008, the annual meeting of the American College of Physicians. Panel discussions focused on the medical profession's most important issues. ACP President Dr. David Dale, Dr. Yul Edgeness, Deborah Ness, President of the National Partnership for Women, Helen Darling, President of the National Business Group on Health, and Dr. Ryan Meyer were on the panel that addressed the looming primary care physician shortage.
I'm David Dale, the President of the American College of Physicians. I'm here today to talk with you about the problems that are currently facing primary care physicians.
On average, physicians spend at least 20% of their day doing work related to patient care that they receive no compensation for. And I think those numbers are probably a little bit shorter than the reality. Every day, I spend at least an hour after my workday to call patients back, to discuss lab results, to discuss abnormal test results. I don't put that on my ancillary staff or my nurses to do. I do that personally, but that's not compensated.
My work week's about 60 hours, and only about 30 of those hours are actually spent seeing patients.
So when I was asked to talk about primary care from the perspective of patients and consumers, my initial reaction was, well, it's a no-brainer. Of course we're fighting for more resources and more focus on primary care. We're concerned about the quality of care, we're concerned about the cost of care, we're concerned about access to care, and we're concerned about the terrible disparities that exist both in access and quality of care. And you can't get to solving any of those problems if you don't fundamentally change the way in which we're delivering care and paying for care today, and unless we get to a place where we're putting more emphasis on primary care.
It's transforming what we pay for. So we pay for health, not just health care. We pay for outcomes. We pay for communication. We pay for the things that patients want as well as health care through the physicians.
Primary care is in a crisis for a number of reasons. I think where we see it most directly is not enough general physicians, internists, family physicians to see people and to provide their long-term continuity care.
I think the problem is that we don't have enough physicians wanting to do primary care, and we also have a lot of docs doing it who may not want to do it much longer or feel stressed doing it. And the reasons have to do with the way we pay for care, the changes in how we deliver care, especially to the older patients who need a lot of coordination, need a lot of time in terms of talking to families, reviewing labs, reviewing other physicians' care. And the system right now isn't built to pay for that. So that puts a lot of stress on the physicians to do the job they want to do, yet be able to stay in business.
The initial solution, I think, is revamping the entire value of the healthcare system. For one, to put more emphasis on cognitive care, and number two, to help establish the patient-centered medical home, which is a concept that ACP has been very aggressive about with our policymakers.
And we specifically are promoting legislation that would provide loan forgiveness or scholarship for young physicians who choose primary care, satisfy a service obligation of several years in practice, and for each year they did that, their debt would be reduced. And the second part of that is change the way Medicare pays for services so that we pay for care coordination rather than just face-to-face visits. So we pay for the time that physicians spend with patients, helping them not see specialists when they don't need them, or seeing the right specialists when they do need to see a specialist.